Obamacare. Our next guest is not only a congressman, he's been a physician for 26 years, a combat surgeon who served in Iraq. His constituents in Ohio tell him that either their insurance rates are going higher or their policies are being canceled, contrary to what the president has said repeatedly. Joining us tonight, Congressman Brad Wenstrup, a member of the House Republican Doctors Caucus. He also serves on the House Armed Services Committee and the House Veterans Affairs Committee. Congressman, great to have you with us. One of the impacts of all that is happening in the nation's capital and Obamacare is that apparently now we're going to see millions, an estimated now 2 million Americans already have had their policies canceled. They are without health care, and in some cases that puts their lives at risk. What can be done here?
Well, there's a lot of people clearly in a state of disarray. And if you look back, what did we ask for? We have people in the House of Representatives, especially on the Republican side, which I'm very familiar with, that not only are doctors, but are business people. And they recognize that this was a plan that was not ready to go and wasn't going to work. And now the American people are going to suffer because of it. You know, I look at some of the young people, and I wonder about this. If you are young and healthy, and you are supposed to buy an expensive policy, maybe you pay the $95 fine and see if there's still a free market out there to buy a policy that costs you a whole lot less, that really fits what your needs are. But America is in a state of disarray, and it's all over, and the trust in America is way down.
You're hearing from your constituents that they're having their policies canceled, that the premiums are going higher. Are you hearing anything like, thank you, Congressman, because all of you and your colleagues in Congress are doing a bang-up job, and we love government because it's doing so much for us?
No, the thank yous I do get are trying to stick up for getting a plan in place for America that actually gets people care. You know, the president's out talking about how many people have insurance today. Most of those, the large percent of those, are Medicaid. Studies have shown people don't have access to primary care, especially through Medicaid. You haven't solved anything. You haven't solved the access problem. We should have been addressing who's uncared for in America and how we can get more people into true primary care, into the specialty care that they need. This doesn't address that. We're still going to have a large number of uninsured people, and we're going to have a larger number of people on Medicaid. It's a safety net, and that's what it's supposed to be. The best thing you can do for someone is get them a job where they can have decent insurance, and that gets more to the economic side of things, which aren't working well either.
This president, this administration seems utterly content with the level of unemployment and underemployment in this country, much of it, as you know, chronic. This is a president, as you go through his agenda, from the day he walked into office, Obamacare is his signature law, the Affordable Care Law. And here we are with a mess that threatens lives. It threatens 1/6 of the economy and potentially our entire economy because, as Nancy Pelosi said, if you want to read it, you'll have to pass it. And I don't think many people took her up on either the before or the after. We have a pending disaster on our hands, don't we?
It's right in our hands. And you know, Lou, there's a big difference between organizing a community of like-minded people than actually leading a nation, or taking on a business proposal that pertains to 1/6 of the American economy if you've never run a business. And that's what we're seeing. And it really is a shame, a disaster for the American people. You know what? We're a tough nation, though, and we'll bounce back, but we need proper leadership if we're going to do it. I just look at one project, like the XL pipeline, that both Republicans and Democrats want. Do you know how many people will put to work with something like that? And all the things that we can do if we reduce regulations and get Americans back to work. This is really what America wants, and this is what's being stopped left and right.
You know, the president went up to Boston the other day, as you know, and he wanted to make some comparisons between Romney Care and Obamacare. And we took a look at it, and the one thing he forgot was bipartisanship, bringing people together. It was overwhelmingly approved by both parties in the state of Massachusetts. He also overlooked another thing when he makes a comparison about Medicare, the biggest entitlement program of all. It was approved by the majority of Republicans in the House of Representatives and almost half in the Senate. And yet this is a president seemingly content to proceed in frankly, what I perceive as an authoritarian manner.
Well, you know, Lou, there was an argument on the floor during the shutdown by one of my colleagues on the Democratic side. He made a beautiful case of how Abraham Lincoln and Eisenhower and Reagan came together with the other side and did great things together and showed great leadership by bringing everyone together. And then he finished by saying John Boehner should do the same thing. He missed his own point. It's the president that needs to do this, and we have people that are willing to cooperate with this president and lead this nation to brighter days, but we've been shut out. I have not been asked by the president of the White House as a physician what I think, and I don't think any of the doctors in the House of Representatives have, most of which are Republican. We have doctors, nurses, dentists, and we're not being tapped.
And we're going to have 90,000 fewer doctors as a result of Obamacare by the end of this decade. As many as 800,000 too few nurses in this country. Yes. Congressman, great to talk with you. We appreciate it. Come back soon.
Anytime.